Hello, I'm Tariq Faridi. I'm originally from Pakistan, came here at age 16, went to school, got a bachelor's degree in business administration from the University of Redlands, completed that in 1980. After about a 10-year absence, I did my first 3 years and then got into business in the import-export business, and then went back to school after having 4 children and finished my bachelor's degree in business administration. Then I'd finished my master's in divinity at the Golden School of Theology in Stockton, California. And now I just recently completed my doctorate in viscerosomatic neurotheology, correlations between scientific truths about health and what the scriptures say in 1 Thessalonians 5:23, Ephesians 4:15 and 16, Hebrews 4:12, 3 John 2, and the basis of the chiropractic profession's spiritual foundation and Colossians 2:19 that is embedded in these verses. So my latest degree and the dissertation that completes will be a scrutiny of the literature of every organ mentioned in the Bible from Genesis to Revelation, its link to disease, and what it talks about when the Bible talks about the rottenness of bones or the lack of nourishment of your joints, as it's in Colossians 2:19, and how the disease develops and what organs are innervated, and then validating that same spiritual reference with a literature base of doctoral dissertations for the 24 vertebral subluxations, 24 vertebra, and one doctoral dissertation for each segment that I have found in literature. And my doctoral dissertation, my latest academic work that I'm completing, is that work of producing a doctoral dissertation to prove that 24 other doctoral dissertations have already been done to validate scientifically the ability of a chiropractor to detect diseases and the benefits of a chiropractic adjustment in achieving optimum health by not treating diseases, but by removing the subluxations that lead to a central nervous system dysfunction, which then leads to disease. And by correcting it, it's restored, the dysfunction is removed by removing the subluxation. So why has media given the label to Tariq Faridi, the walking encyclopedia of healthcare? Well, if you study the Bible and you want to tell other people about the Bible, but you do not tell about Jesus, you didn't get it. Similarly, if you're a good researcher and a historian and you study health and you exclude chiropractic and the benefits and the greatness it has, you didn't get it. So the reason I talk about chiropractic is not because I went to chiropractic school. Somebody asked me yesterday at a seminar, why didn't you become a chiropractor? Because there's 70,000 chiropractors already out there that need to learn what I learned about the great profession they're in. The chiropractic colleges did not teach them the foundation of what chiropractic is. The concept of chiropractic was taught 5,000 years before the Bible was written. It was, secrets were written. Sir Edwin Smith in 1930 brought papyri back where the human spine, the human body was inlaid, the spinal nerves were inlaid with cryptic codes explaining each vertebra, C1 vertebra, the nerve it connects to that goes into the brain, and how pressure on that nerve causes migraine headaches. Now science has papers that say rheumatoid arthritis and atlantoaxial instability. Atlantoaxial is the atlas axis, the C1 and C2 vertebra, and the C1, C2 subluxation. This is a medical journal. And it says atlantoaxial instability, C1, C2 subluxations as a contributing factor to rheumatoid arthritis. Unfortunately, in my case, an undetected, uncorrected subluxation, it was so devastating that it can take a life. In my case, it took the life of my daughter because she was born by a damage done by the delivering physician and fracturing her C1 and C2 vertebra. So you can imagine if the pressure was so much that the child died. A little lesser pressure than that, it gives children earaches for life, asthma for life, infections, intolerance to that, constant colds. It's because when you're born, so if you're a parent of a child, get your child examined by a chiropractor. They have the ability, without a stethoscope and without an MRI, with their fingers and the laying on of hands in the direction of God and the gifts they have been given. If somebody's gone to chiropractic school and is passionate and is trained in palpating the spine, meaning through the fingers, feeling the tenderness and the inflammation, because disease happens because of inflammation. The arteries get clogged, the arteriosclerotic plaque starts building because it's not passing, the oxygen flow, the blood flow is reduced. That's what subluxations do. And the chiropractic hands, the fingers palpate to find out what's wrong, and the adjustments restore the flow and the communication back between that organ and the brain. The circuitry, the electricity that travels through our body is called the central nervous system. The 12 cranial nerves, the 31 spinal nerves, the nerves ends in the organs, and the organs are nothing but the extension of the brain through the spinal cord into the spinal nerves, and the organ themselves are the nerve root endings of that. So your whole body is managed. You know what the skeleton God created? To protect your spinal cord, which is a part of your central nervous system. You know why God created chiropractors? To be bodyguards and protectors of that spinal cord inside that vertebra, and the rotations of the vertebral bodies, the tip of the spinous process, and the transverse processes. Chiropractors are trained to feel and know what is going on inside your body. Just yesterday, I'm not even a chiropractor, I've just got simple training to feel tenderness and rotation of the spinous processes and tips, vertebral bodies. And I touched the lady and I checked her C5 and T6. I said, what disease do you have? And she told me she had diabetes, and I asked her if she was on medication. So chiropractors can feel and know what is going wrong in your body. And the body needs no drugs. It doesn't even need herbs and vitamins. It just needs a central nervous system that is free of interferences. But interferences cause the subluxations. Chiropractors detect the subluxations and correct the subluxations. So in ancient times, and there's this relief painting, not painting, relief sculpture in this cave in Cairo, Egypt, where there's a picture of cirrhosis of the liver and the bone setter adjusting the vertebra so his cirrhosis of the liver can be corrected, because he was a very severe alcoholic, this king. So similarly, I had the privilege of studying about in 1543 Sir Friar Moulton. He was a bone setter, and in 1867 Sir James Paget wrote an article, and he said in that article to the medical doctors that you better learn what the bone setters are doing, because if you don't, they will cure diseases that you cannot detect and correct by correcting the bones, and as a result restoring the central nervous system and removing the things that are causing diseases. So science has always known. The AMA conspiracy was to block patients from knowing, because they knew the pharmaceutical industry did not want chiropractors to succeed, because if they did, that would mean failure of pharmaceutical industry. And it will happen. Whatever you fear happens, and thank you, pharmaceutical industry, you will eventually fail. Chiropractors will rise. We will see to it that the physician and the patients and the consumers know the truth. Thank God that through YouTube and Vimeo and Facebook, we have the ability, without mega bucks that you guys have, to destroy and poison the world, to tell the truth and remove the harms you're causing, and instead bring the truth out to heal the body by restoring the power that made the body, that gave it the ability to heal itself through the innate intelligence. And now our scientists, neuroscientists like Candace Pert and Bruce Lipton have written papers, The Science of Innate Intelligence. Google it and you'll find a 48-page paper, beautiful, that talks about it. Candace Pert has pictures of cellular immunity. The innate intelligence is not just in your brain, it is all over your cells. We remember things, our body remembers things, and the great thing is it remembers how to heal itself. But if there's subluxations, there's a block in the communication between the brain and the organs in the body to not heal. So the chiropractic profession did not just start in 1898 when D.D. Palmer gave a thrust to Harvey Lillard on his chest, and through that reverse thrust helped restore and corrected the subluxation in the spine that was causing hearing loss. And contrary to popular belief in the non-chiropractic chiropractors that think chiropractic has nothing to do with visceral disease, it did not start with back or neck pain. Chiropractic was started by restoring hearing. It was started to correcting of a visceral disease through a chiropractic adjustment. And so chiropractors are trained to locate dysfunction vertebra, the C1 and C2, headaches and sinus, C3, diaphragm, C5 and 6, pancreas and stomach, C7, spleen, so T1 and T2, the heart, T3 and 4, same thing, heart and the lungs, T5 and T6, stomach and pancreas, T7, spleen, T8, gallbladder, T9, adrenals, T10, your colon. So all the vertebrae you go down, T11 and 12, again, kidneys and bladder, L1 through L5, the male and female genitalia. So when you're feeling a back pain, it's some connected organ that is developing dysfunction as a result of the food you're eating, as a result of an argument you had with somebody, a stressful relationship, loss of a job, changing, moving, just different things that happen in life that create chemicals. We react to different things in life, and as a result, we create chemicals, and those chemicals then start dehydrating the intervertebral discs, and when the dehydration happens, it stops the motion. And when you stop the motion in your joints, that's when you end up having a subluxation. The subluxation is the final sign of a disease process that is already developing in the body, and the chiropractors have the ability and are trained to detect and correct that development and restore your joint of motion, restore correct your subluxation. So chiropractic care, the foundation of it, in 1890, Sir Henry had wrote a paper called Visceral Disturbances and Pain and the Relationship to the Body thereto. And then in 1933, Dr. Neville T. Usher wrote a paper called Spinal Curvatures and Deranged Vertebral Structures and the Relationship thereto. Dr. William Sky in St. Louis in 1972, he wrote a paper called Vertebral Malformations and Somatovisceral Anomalies. So what that means is that changes from the norm of the position of the vertebra, those changes indicate, and he wrote a paper documenting every associated disease like it. And he was looking at the paper written in 1921 by Dr. Henry Windsor, who did autopsies on 143 cadavers, and out of those 139 of them, he could look at the damage to the discs and accurately tell you backwards what disease that patient died of. And Dr. Sky reverse engineered that, look it forward, and he could look at the data of what emotions are happening between the mother during the gestation period from conception to birth. And during those 9 months, your spinal cord is shaped, your vertebrae are shaped, and based on the foods the mother was eating, the emotions, and the different physical activity, he could predict what curves will occur in the spine and what diseases this child will develop in the next 17 years. And he was 98% accurate. So there's that kind of a data available, the bedrock of truth and scientific facts that chiropractic is based on. Medicine, they practice medicine. Chiropractors, they touch your body and they restore the body's healing mechanism. Big difference between an MD. They practice medicine. Chiropractors create health. So going back to, I'll go from 1972 to now and list in each decade some of the critical papers that have been written. And if you're a chiropractor, you need to listen to this remainder part, because I will summarize again. I will take the last 110 years, and each decade I will share with you a key scientific paper that was published to validate the philosophies and the art and science of chiropractic. The D.D. Palmer based his foundation on starting the chiropractic profession. So in the 1980s, Dr. Irvin Core in 79, 81, 82 wrote the 4 papers called the spinal cord as the organizer of the disease process. And he documented how the disease flows through the organs when there's interferences in the spinal cord as a result of what chiropractors call subluxations. And he worked with osteopaths, and what osteopaths called a spinal lesion, which is one and the same thing. And then say, let's go to 1990, Dr. Jennifer Jameson in Australia in the Journal of Manipulative and Physiologic Therapeutics wrote a paper called Chiropractic Adjustment in the Management of Visceral Disorders. Amazing paper, thinking along the exact same lines. If you study the truth, you will find the basis of the link between vertebral subluxations and the development of chronic degenerative diseases, or as I call them, visceral diseases. Then we go back from 1992 to say, come to the year 2000, Dr. Dr. Gottlieb in 2010 wrote a paper on infantile colic and asthma in children as a result of subluxations. And then in 2010, as recently